Hi everyone, welcome back to my YouTube channel, and today we are going to talk about autism. So let's start our topic with introduction. Autism, medically referred as autism spectrum disorder, is a neurodevelopmental condition that affects communication, social interaction, behavior, and learning. It is called a spectrum disorder because symptoms and severity vary widely among individuals. Autism typically appears in early childhood and continues throughout the life, influencing how a person perceives and interacts with the world. Definition of autism. Autism spectrum disorder is a developmental disorder characterized by persistent difficulties in social communication and social interactions, along with restrictive repetitive patterns of behavior, interests, or activities. These characteristics affect daily functioning and development and are present from early childhood. Causes of autism. The exact cause of autism is not fully understood, but it is believed to result from a combination of genetic and environmental factors. Genetic factors play a major role in autism. Certain genes are associated with brain development and function, and mutations or variation in these genes can increase the risk of autism. Autism is more common in families with a history of disorder. Then there are environmental factors, as environmental influences during pregnancy or early developmental may contribute to autism. These include advanced parental age, parental exposure to certain medications, infections during pregnancy, and complications during birth. Vaccines have been scientifically proven not to cause autism. Characteristics and symptoms. The symptoms of autism usually appear before the age of 3 and vary in severity. First is social interaction difficulties. As individuals with autism may have difficulty making eye contact, understanding social cues, forming relationships, or responding to emotions of others. They may prefer to be alone or have limited interest in social interactions. Second thing is communication challenges, as communication difficulty may include delayed speech development, absence of speech, or unusual speech patterns. Some individuals may have difficulty understanding language, gestures, or facial expressions. Third thing with autism is repetitive behavior and restrictive interest. Common behavior include repetitive movements such as hand flapping or rocking, insistence on routines, and intense focus on specific interest. Changes in routine may cause distress. The next factor with autism is sensory sensitivities, as many individuals with autism experience heightened or reduced sensitivity to sensory stimuli such as sound, light, textures, taste, or smells. Types and spectrum. Autism is considered a spectrum disorder because it affects individuals differently. Some people may require significant support in daily life, while others may live independently and excel in specific area. The spectrum includes individuals with mild, moderate, or severe symptoms, and depending on the life's level of the support needs. Diagnosis of autism. Autism is diagnosed through behavioral observation and developmental assessment. There is no single medical test for autism. Diagnosis usually involve developmental screening, detailed evaluation by specialists, and assessment of communication, behavior, and social skills. Early diagnosis is important for timely intervention and better developmental outcomes. Management and treatment. There is no cure for autism, but early intervention and appropriate therapies can significantly improve quality of life. Like behavioral and education intervention, behavioral therapy helps improve communication, social skills, and adaptive behaviors. Structured educational programs support learning and development. There's one another thing including in the management, that is speech and language therapy. As speech therapy helps individual develop communication skills including verbal and non-verbal communication. Third thing with management of autism is occupational therapy, as occupational therapy assists in developing daily life skills, sensory integration, and motor coordination. Fourth management strategy is medical management, as medication may be prescribed to manage associated symptoms such as anxiety, hyperactivity, or sleep disturbances, but they do not treat autism itself. Role of family and society. Family support play a vital role in development and well-being of individuals with autism. Awareness, acceptance, and inclusion in school and communities help individuals with autism reach their full potentials. Support services and counseling are important for caregivers. Prognosis of autism. The prognosis of autism varies depending on the severity of symptoms, level of support, and timing of intervention. Many individuals with autism lead productive and fulfilling lives with proper support, education, and therapy. Myths and misconceptions about autism. Autism is not caused by poor parenting, vaccines, or emotional neglect. Individuals with autism are not intellectually disabled by default, intelligence levels varied widely. Autism is a neurological condition, not a mental illness. Conclusion of this lecture video. Autism spectrum disorder is a complex neurodevelopmental condition that affects communication, behavior, and social interaction. Although it is a lifelong condition, early diagnosis, appropriate intervention, family support, and social acceptance can greatly enhance the quality of life for individuals with autism. Understanding autism is essential for promoting inclusion, reducing stigma, and providing effective care. And this was all about autism. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.